Welcome to another video on World AIDS Day. We know that World AIDS Day is commemorated on December 1st every year. And this year, the theme is Take the Right Path, My Health, My Right. So today on the video, we're going to just go quickly, I should say, review the WHO, World Health Organization's page for World AIDS Day and just look at some of the highlights that's happening in the world today as it relates to HIV prevention and treatment. My name is Suzanne Robinson Davis, and I am with Health Improvement Visionaries. I am a consultant, and my role is to assist health centers, community health centers, address health in their communities. I am focused around minority health. How do we ensure that health equity is being achieved for our people and our communities? So if you have never gone on the WHO's website, this is what the World AIDS Day page looks like. And the global theme is Take the Rights Path. And so in healthcare, we have evolved into recognizing the health disparities across many groups, including racialized groups, including sexual minorities. And so with HIV becoming, and HIV, and I should say AIDS, becoming such, I would say, a role model in healthcare, a number of best practices have come out of how the world has managed HIV care and how we have integrated HIV care into primary care, have set a real mark for health. And so it's important for us to not only recognize and commemorate World AIDS Day, but also recognize the impact, the positive impact AIDS, HIV prevention and care has played in addressing health broadly. A number of persons continue to die from HIV and AIDS, and it's important for us to recognize the light that they have shone in this world, address the issues that are impacting others who are living with HIV, and also making sure that we pave the way. We make sure that we are looking at broad outcomes for health, that we are addressing the whole person. And that is where rights comes in. So let us just go through and see some of the major highlights that are on the page. So one of the call to action from WHO is make your voice count. And so this is one way I am making my voice count. What are the ways you are making your voice count as it relates to health equity? We need to help to ensure that everyone, everywhere has the right to quality healthcare services and in the fight against HIV and AIDS. But let us speak broadly to public health, right? So we want to make sure that everyone has the right to quality healthcare. And it's important because we are seeing a number of negative outcomes as it relates to inadequate care. But just specifically around HIV, in 2023, an estimated 39.9 million, almost 40 million people were living with HIV around the world. 630,000 of those persons died in 2023. So we are seeing I would still say a high mortality for persons who are living with HIV and AIDS, with increased ART that's available, new innovations coming through with long acting injectables. We need for those innovations to permeate not only developed countries but developing countries. We need to have access in developing countries, because majority of the death, although there are high mortalities in developed countries, but particularly in developing countries, we're seeing high rates of mortality. And so we need to make sure that even across countries that there is health equity. And that requires partnerships, right, with researchers and big pharma and the pharmaceutical industry. We need to see those innovations translated into developing countries. And then incidence rates, 1.3 million people acquired HIV in 2023. So this, excuse me, HIV remains an issue in public health. We have to curb the number of persons who are getting infected, and that requires a number of advocacy promoting preventive measures, PrEP being one of the new kids on the block, and making sure that prevention through those methods are communicated at the lowest level in our communities. And that is important for us to be able to address the systemic issues that require that denies people the right, or denies them the access to these services. So a few key messages we see WHO highlighting. One, let's get it right. Everyone deserves to access HIV testing, treatment, and care. And that is something that most of my work in healthcare has been around, making sure that my community has access to HIV testing. We need to know our status. If we know, then we can act. When we don't know, then we don't act, right? And then we find out later when the disease has progressed. So we want to make sure that we are giving access to treatment, to testing, to care at an early stage. Another message, there's more than one way to prevent HIV infection. And it's so incredible the number of innovations that have been made over the past 10 years. So we knew about condoms, for preventing STIs, sexually transmitted diseases. The vaginal rings are being tested, and they're good success, right? For folks, a number of studies have been done in Africa, Southern and East Africa. And so there are high rates of prevention or efficacy there. PrEP is a big one, and I have been a part of rolling out new PrEP programs, policies, designing programs, measuring, delivering to community, seeing great uptake, particularly in New York City. And so these are very important for us to be advocating at the primary level, right, where the community touches health center, that these are options that are available. And then the other area is, or the other message is, help everyone feel safe accessing HIV care. And, unfortunately, HIV stigma is still a major concern. Discrimination is still a major concern. And I have seen where healthcare providers need to check their biases. And I think this is a really good point here on this flyer, because culture plays a role. So one of the things that is important to always remember is that even though we are trained, whether in advocacy or prevention or as a medical provider, we are still made up of our community, our values, and our culture. And I know that in many cultures, there is a high bias or a tendency to discriminate against persons living with HIV. We think, oh, it was a choice that they make, it's a lifestyle, that lifestyle doesn't align with your lifestyle. And so there is a bias that comes across as a healthcare provider. And so we have to make sure that we're checking ourselves, but also that we're checking each other. This is not a boys club in which we hide and pretend that we don't see our other professionals showcasing bias in different ways to our patients, to our community. And so we have to make sure that we are checking our biases not only for ourselves but for our colleagues. We also need to ensure that as professionals, we understand and know the facts, but also not only for our education, but for the education of our community. So often we see where healthcare providers are not giving or sharing the facts around HIV and AIDS. We see where maybe a little piece of information is given, but not the whole brief. It's important in breaking down biases and in stopping stigma and discrimination that we demystify the issues surrounding HIV that we know are cultural, that we know are wrong. We are in a position to address these with our communities. We have workshops, we have educational sessions, we have provider to patient sessions, we have sexual health and risk taking histories and immunizations and all different points of contact with our communities. And we have to make sure that we are using those times optimally in reaching persons with getting the facts and stopping stigma and discrimination. There is no place for that. It's not needed, not in 2024 going into 2025. We need to move to something else, and we need to make sure we are achieving that. And so with all of that, standing on my soapbox and spieling out all of that, I'm speaking to this other poster, which I didn't even know was here. It says, "Speak out for comprehensive HIV services in your community, education, prevention, testing, and treatment." And I've worked in many, I want to not say many, I've worked in a few countries and across different organizations. And I have seen where persons, your colleagues, your leaders in the healthcare organization, they get a little bit uncomfortable when you talk about, HIV services and addressing certain barriers. They themselves, cloak up, like, they put on that jacket. And I am getting excited because, we can do, this, we can have a street fair, we can, invite all these people and we can talk about HIV. And I see persons, really just get a lot of, they get choked up and they really put on that cultural bias. And so it's important that for us to do extensive testing, for us to do extensive education, for us to be able to ensure that the prevention methods and messages are going out, and for doctors and healthcare providers, nurse practitioners, physician assistants, for everyone who is doing treatment, that they are also part of that continuum of care that's been implemented in the communities with that energy, that drive to ensure that access is part and parcel of the work that we're doing. And I want to say finally, but let me just cover these other 2 points. Uh, if you have HIV, you can achieve viral suppression. We previously it was undetectable equals untransmittable, but I think the WHO has done a good thing in breaking down what the word untransmittable means, right? It's such a tongue twister anyway, but it means here zero risk of HIV transmission. And that means if you're living with HIV or you know someone who is living with HIV, you can say to them, I know that if you're undetectable, you have zero, zero risk of transmitting this disease. And if it is that they know, they will explain to you even more about their knowledge. But the thing about it is that if we are able to openly say to someone who we know who is living with HIV to say, oh, I know that there is this state of being undetectable. Are you undetectable? This, it just opens the conversation. It breaks down so many barriers, and we need to make sure that we are barrier breakers, that we are coming to our community with love and support and enthusiasm. We're not only enthusiastic about the party and the movie and the dates and all of these social outings, but we are excited about your health and how we can contribute to that, and understanding some of the challenges that our friends and family and community are experiencing that is preventing them from being undetectable. There are so many factors. For us in healthcare, we would say social determinants of health. There are many social determinants of health: housing, transportation, income, there are so many barriers, right? But we can be part of the solution. We can encourage our friends, families, community members to take their medication. We can ask them, when last did they have that test that tells them whether they are undetectable? We can, whether we know the language or not, we can start in a caring way inquiring. I asked my mother about her numbers for her blood pressure. If she goes to the doctor and get her blood test, I ask about her numbers for diabetes because she's pre-diabetic, as with most of us. I ask those numbers. So let us get so much more normalized to ask numbers for persons who are living with HIV. Let us ask about numbers or health numbers. So I leave that with you. And then this last poster on my left says, you have a right to know your HIV status. We all do. And absolutely, we need to make sure that our partners are being tested. You know, my son turned, I know, my son turned 18, and of course, I look 18. So, you know, there's a math problem there. However, you know, I have been talking to him about safe sex and, well, for us, no sex, but still talk about safe sex. And also making sure that when he goes to the doctor, he asks about the HIV test. Because what I find is that the doctors sometimes, not all doctors, but sometimes, doctors tell you about all the different tests that they are going to run, right? Okay, yes, so we're going to do this test and that test and that test, but nobody is talking about the HIV test, which they have to, at least in the US, they have to say it to you before they run the test. They can't not say it and then run the test. So If they're not listing it in the test, then they wouldn't be running the test. So I have equipped him. So if he doesn't hear the word HIV, he should say it. So we have to make sure that even community is transforming in a way that we are pushing the health sector to do more, to do more. When I go in for HIV for blood work, I listen out keenly if I'm going to hear, and many times, more often than not, I do not hear. I do not hear. And then I open the conversation with it, and then it turned out, oh, you're in healthcare, so and so and so and so. But those things should not be. It should be standard. We should be talking about getting tested and for everyone to know their HIV status. So let us see what else WHO has on their page. All right, so let us play this video. I'm not sure if you're going to hear it. No. Okay, so with the tool I'm using to do this recording, I'm not able to play the video. But WHO on its website for World AIDS Day has a number of videos coming from the community leaders, from advocates, sharing their story. There's so much information here. WHO is doing a good job, but they alone cannot stop HIV and AIDS from permeating our communities, from wreaking havoc. We have a role to play as we acknowledge, as we commemorate World AIDS Day. If you know someone who is living with HIV, go and give them a hug. Let them know that you are rooting for them. And if there's anything that you can do to support them, you are there. Also, I am a big advocate for primary care and for community health centers. What is your local community health center doing about HIV and AIDS? Is there a program that they have for your community? Ask questions. No more. That is the only way that we are going to help to curb the disparities in health that are impacting minority and vulnerable populations. And so with this, I bring my video to a close. I thank you so, so much for joining me. Again, my name is Suzanne Robinson Davis, and I am with Health Improvement Visionaries. And on this channel, we create content that inspire program leaders working in community health to support their minorities, their vulnerable populations, their racialized populations, their indigenous populations to achieve better health. Thank you so much for joining me, and meet me back here next time.